Friends and co-workers of 27-year-old Michael Odell are heartbroken. The travel ICU nurse from Oklahoma had been working at Stanford Hospital before committing suicide last week.
Michael was incredible. He was fearless. He lived his life fully. He finished nursing school at 20 years old, which is a feat in its own. He's just a genius to me.
Josh Paredes was best friends with Odell. As a fellow nurse, he says the stresses of the job have become overwhelming for so many in the healthcare field. Paredes believes it's important for people to hear Odell's story.
I think he just couldn't take it anymore. I think across the country, and probably world, but I've seen statistics where suicide is up with healthcare professionals, and that's why I think it's so important that we talk about this.
A recent study published in the Journal of General Internal Medicine included a survey of more than 500 doctors, nurses, and other healthcare workers who have been treating COVID patients. Within it, they found 74% saying they were depressed. 37% reported they were experiencing symptoms of post-traumatic stress disorder, and 15% said they had thoughts of suicide or self-harm.
I mean, it's tragic. It breaks my heart to think that if he didn't feel like he had the support.
Stanford nurse Gabby Ledoux helped in the frantic two-day search for Odell, who abruptly left work and went missing last Tuesday. The search ended tragically on Thursday when Odell's body was found at the Don Edwards Wildlife Refuge. Ledoux says right now, frontline workers across the country need more support.
People who are not in the healthcare field do not understand the weight of how COVID has affected all of us, and we are going through mass burnouts at other hospitals and therefore losing staff.
Odell's colleagues are hoping employers will step up in their efforts to address the well-being of their workers. For Paredes, Odell's death is pointing out the need for these conversations.
Because the more we talk about it, the more we'll kind of dismantle the stigma attached to mental illness, and maybe people will be more inclined to speak up when they're hurting.
Reporting in Pleasant Hill, Dan Thorne, KRON 4 News.
Stanford Health has released a statement about Michael's death, saying they give their support to all caregivers and staff, and while he wasn't with them long, they added that they're saddened by his death. And staying on the topic of mental health during the pandemic, as we are now about 2 years into it, we are starting to see some solid numbers about the effect it's had on mental health.
Yeah, just one example, a study from Stanford Medicine looked at more than 1,000 healthcare workers who demonstrated signs of post-traumatic stress. More than 15% of those people that they talked to said they had considered suicide because of the added pressures of the pandemic, and that's roughly 3 times higher than the usual national numbers.
And that's not all. Burnout is also continuing to rise among healthcare workers. According to Becker's Hospital Review, 18% of all healthcare workers in the country have quit their job since February of 2020. People surveyed say not only have the longer hours and witnessing so many people dying weighed on them, they note the harassment and even violence they've faced from conspiracy theorists and people who refuse to believe in science.
If you or anyone you know is suffering with a mental health crisis, COVID-related or not, you can reach out to the numbers you see there on your screen. They are free, they are confidential, and available 24 hours a day, 7 days a week.